Good evening. If we could please find our seats, we'll go ahead and begin the session. Thank you so much for joining us for the 2015 Carroll C Arnold Distinguished Lecture. My name is Christina Beck, and I am the NCA First Vice President, and I've had the honor of being this year's primary program planner. And I'd like to thank all of you for joining us this evening. I'd also like to take a few moments and acknowledge some of our key sponsors for various events at NCA. First of all, I would very much like to thank Rutledge, Taylor, and Francis for sponsoring yesterday's outstanding opening session. If you didn't have an opportunity to join us for that event, I encourage you to check it out online when it's uploaded after we get back from the convention. I would also like to thank Ohio University Scripps College of Communication and the Ohio University School of Communication Studies for so generously sponsoring or helping to sponsor last night's wonderful welcome reception. And tonight, I would very much like to thank Pearson for sponsoring this event. You're all in for a treat. And now I need to put my glasses on. After learning that I would have the honor of serving as program planner for this year's convention, two pieces of the convention puzzle fell into place very swiftly. My choice of convention theme, Embracing Opportunities, and my selection of the 2015 Carroll C Arnold Distinguished Lecturer, Arvind Singhal, the Samuel Shirley and Edna Holt Marston Endowed Professor of Communication and Director of the Social Justice Initiative at the University of Texas, El Paso, as well as the William J. Clinton Distinguished Fellow at the Clinton School of Public Service in Little Rock, Arkansas. Employing innovative strategies for addressing important social issues, Arvind has collaborated on life-changing projects around the world, and his work illustrates the vast potential of communication scholars to embrace opportunities for impacting local and global communities. The co-author and editor of 13 books and over 175 peer-reviewed articles, Arvind's work employs the positive deviance approach, entertainment education, liberating interactional structures, and diffusion of innovation. He has received funding support from, among others, the National Institutes of Health, the Dutch Health Research Council, the CDC, UNAIDS, UNICEF, UNDP, UNAIDS, UNFPA, the U.S. Department of State, Save the Children, and the BBC World Services Trust. As his bio details, his research and outreach spans sectors such as health, education, peace, human rights, poverty alleviation, sustainable development, civic participation, democracy and governance, and corporate citizenship. During tonight's Carroll C. Arnold Distinguished Lecture, Arvind will present Flip It, how complex social problems can be solved simply and communicatively by looking for positive deviance. His presentation fits beautifully with our convention theme, Embracing Opportunities, given his argument that, driven by data, the PD approach flips the normative ways of conducting expert-driven needs assessment and gap analysis on its head and follows a systematic process of uncovering cost-effective and culturally appropriate solutions from within the community. Arvind's lecture holds relevance for members across our association. And as we enter this next century of our National Communication Association, I appreciate his emphasis on embracing opportunities for pursuing positive alternatives to serious social issues from a communication-based perspective. It is my incredible honor to introduce you to Dr. Arvind Singhal. Arvind.
Oh, the spotlights. And I'm wired, and people at the back can hear me? Yes, that's good. And oh, I knew very little about Carroll C Arnold, but as I read about him and what a influential teacher, researcher, human being he was, in some ways I feel his spirit smiling down on us. It's also terrific to see friends and colleagues from yesteryears. I wouldn't say how many, but from yesteryears. So, flip it. And of course, there's the obligatory colon, and then there's something after that. And we'll sort of muddle our way through the notion of, what the positive deviance way is, what complex social problems are, and what role communication can possibly play as a discipline, as an area of research, as an area of scholarship, perhaps even as an area of practice. So the first slide is a blank screen. And if you invoke the Zen philosophers, they would say that a blank screen may represent a beginner's mind, a mind that may have many possibilities, a mind that's curious, a mind that's open. And I want to begin with that invitation to you, to see if you can, even if it's temporarily, even if it's momentarily, even if it's for a few minutes, see if you can reset yourself to beginner's mind. Not easy for those who are experts, and I know there are lots of experts here. And it's a challenge that I'm issuing to myself as well as I have this conversation with you. Now, I want to see if there's somebody in this audience who may recognize a familiar figure. Abraham Lincoln, and you say, Roger, how could you, with pixels on a screen, somebody who existed 150 odd years ago, you're able to recognize him? Well, there's a reason why we begin with a flipped image of Abraham Lincoln. There are many stories about Lincoln, which I greatly love, but the one that especially speaks to me as I do work in the area of positive deviance is the story of Lincoln being in the presence of a soldier. This is during the Civil War, a petty soldier who was meeting for the first time the commander-in-chief, the president. And he sort of, clicked his heels and saluted Lincoln, extended his hand, and as he did so, he realized that his hand had to be sort of like this, yeah? And he said, "Oh, Mr. President, you're tall. How tall are you?" Does anybody know how tall Lincoln was? You're whispering. 6'5", 6'4 and a half. Yeah, I didn't measure him, but that's what I hear. So the question was, oh, Mr. President, you're tall. How tall are you? And without batting an eyelid, Lincoln says, "Son, like you, tall enough that my feet reach the ground." Okay? Son, like you, tall enough that my feet reach the ground. Now, most of us experts respond to questions such as that very precisely. I mean, I've heard people say I'm 182 and a half centimeters tall, or I often say I'm 5'8" and 3/4, and that 3/4 is like really important to me. Precision, yeah, expertise, and sometimes it's, oh, I'm taller than you, or you're not as tall as I am. And what Lincoln's answer, of course, it may mean different things to different people, but what his answer signifies to me is the value of the common ground. And in the realm of what we'll be talking about, positive deviance, what it says to me is that expertise doesn't just lie with the commander-in-chief or with the president or with the professor, but wisdom is distributed. If we have the eyes to acknowledge it, and if we have the heart to see it. And that's not an easy thing for experts, no? That's the reason why we say beginner's mind. Open mind, perhaps, maybe there's some room for some heart there. So let's put Lincoln back in his place. The contention that I am presenting is that we can do a better job of solving complex social problems. And in order to do so, it would be useful for us, if we can, it's not going to be easy, to flip our mindsets. Now, what are complex social problems? I don't need to define them. I'll give you some examples. But these are problems that don't have a simple technical fix. Oftentimes, these problems are relational, they are behavioral, they are hierarchical, not so easy to untangle. Multiple causes, underlying causes, you may partial out this and that, but we don't really do a very good job of explaining too much variance in any dependent variable. No? So we'll talk about complex social problems. The contention is we can, I think, significantly improve our record of solving complex social problems if we made the effort, if we brought in the discipline to flip our mindsets. So the flipped mindset, simply put, since there's positive deviance in the title, is the positive deviance way. And visually, it looks like this. Okay? And we'll tell you more about what it means conceptually or narratively as we move on. So I like to tell stories. Some of you know I do work in the area of entertainment education. So, now I'm on stage, and so I'm going to try to tell you a few stories. I'm going to use the narrative approach to make some points about positive deviance, yeah? So I'm to be held to a test in some ways. The first story is of a fictional character by the name of Nazareth Dean. And I see my friend Jack Condon nodding. How many of us have heard a story of Nazareth Dean? Okay, I do see some. Okay, terrific. Let's see if you've heard this particular story. In this story, Nazareth Dean is a professed smuggler. So, he sort of goes on, let's say, top of Mount Everest with a megaphone and says, I'm a smuggler, and the challenge goes out to all customs officials, catch me if you can. And, so every morning, Nazareth Dean, riding a donkey with lots of donkeys loaded with stuff, comes to the border checkpoint. And there's a customs official who's like, okay, I'm going to nail you today, Nazareth Dean, what do you have? And Nazareth Dean says, look. And the customs official looks, and he really knows how to look, right? He's trained in looking. So he looks here and there and finds nothing of interest. So what does he do? Well, what can he do? He's got to let Nazareth Dean go. Off goes Nazareth Dean. The next day, he's back, riding a donkey with stuff loaded with other donkeys, just tons of things. And the customs official, I'm going to really nail you today, Nazareth Dean. What do you have? And Nazareth Dean says, look. And the customs official really looks, and this time he really looks. Puts on his X-ray glasses and, does the sniffing test and the touching test and this test and that test, and finds absolutely nothing of interest. So what does he do? What can he do? He's got to let Nazareth Dean go. And off goes Nazareth Dean. And this happens day after day. It happens week after week, month after month, year after year, decade after decade, and the customs official is getting increasingly frustrated in his inability to nail Nazareth Dean in an act of wrongdoing. So he goes to, maybe he goes to the Harvard School of Customs Checking now to get a senior diploma in, and learns these techniques and learns those techniques, comes to NCA, attends a pre-conference workshop, whatever. And again, years go by, and he's unable to nail Nazareth Dean in an act of wrongdoing. And finally, one day, the customs official retires, deeply frustrated that he was not able to solve a problem that he was trying to solve. The next day, you can imagine, Nazareth Dean goes top of Mount Everest with a megaphone and says, I retire from smuggling. And they happened to meet. Must have been the Starbucks here in this hotel. The long lines at a Starbucks. And the customs official says to Nasiruddin, now that I'm an old man, now that I hold no official capacity, now that I'm in no position to do anything to you, please, Nasiruddin, could you tell me what is it that you were smuggling? Donkeys, says Nasiruddin. All right. So, why do I tell this story? And let's ask the question, even though it's a story, why was the customs official unable to see what was there right in front of his very eyes? The problem that he was trying to solve, the answer was right there, and he missed it every single time. And the donkey is not a small thing, yeah? It was right there, not one donkey. And how many times did I say donkeys, donkeys, donkeys? I don't know how many of you got it, but, you can realize why we, as experts, often become incapacitated by our training, by our mindsets. Some people call it trained incapacity. Some people call it occupational psychosis. Some people say that if you're a hammer, the world begins to look like a... You have people who talk about, bounded rationality and those kinds of things as well. So anyway, that's story number one. The question is, what do you see? And the flip, what is it that you don't see? So the positive deviance premise is the following. Solutions to complex problems exist. Stare us in the face, we do not see them. We are incapable of seeing them. We are trained, actually, not to see them. We don't even know where to look. And the old problem-solving mindsets get in the way. You ready for story two? Yeah? And who can recognize with pixels and on a screen? Somebody at the back? Mother Teresa? Mm-hmm. So this is, again, a sort of a quintessential story to understand positive deviance, the approach to solving complex social problems. So Mother Teresa, once she arrived in Washington, D.C., and she was greeted by 1,000 people with placards, and a representative walked up and said, Mother, tomorrow we are having a march in Washington. We would like for you to march with us. And she said, my child, what's the march about? He said, well, we are marching against the Vietnam War. And now there's silence. And now she's thinking. And so the representative, so Mother, we are marching against the Vietnam War. You will certainly march with us, right? And she says, my child, if you're going to have a march in Washington against the Vietnam War, I am so sorry. I will not be able to march with you. But my child, if you were to choose to have a march in Washington for peace, I will be the first to lead. So the question to ask ourselves is, for Mother Teresa, in this particular story, was the notion of being against the war and being for peace one and the same thing, or were they very different? Yeah, you don't need to answer it. Different enough that for one, I'm so sorry, there are 1,000 of you want me to, and for the other, if you were to so choose, I will be the first to lead. As problem solvers, because we always begin with the problem, we are always against something. Okay? It's a natural mindset. I'm against drug abuse, I'm against teenage pregnancy, I'm against racism, and there's nothing wrong with that. Right? I think what Mother Teresa is telling us is that it always is useful to flip the mindset, because we have the ability to do so, and ask, what is it that you're for? So as problem solvers, as Christy was saying in the introduction, we do gaps, knowledge gaps, attitude gaps, practice gaps. We begin by saying, what are the deficits in a community? We begin by saying, what are the needs that a community has? we rarely flip and ask, what are we for? We rarely flip and ask, what's working? We rarely flip and ask, what are the strengths? What are the assets of a community? We have so much literature on high risk, yeah? And that's okay, nothing wrong with it. What we are saying is, if you flip your mindset and ask what's working, maybe you'll be at a different place. That's all we are saying. Okay. How's it going so far? Going okay? Yeah, these stories, good. I'm seeing a few thumbs up, good. How are we doing on time? Because I lose track of time when I tell stories. It's about 5. Okay, perfect, good, okay. We'll keep rolling. And we'll speed up or slow down, whichever way it goes. Okay. So far, so good? Good, okay. Story 3, does anybody recognize? This warms my heart. Now it's like, oh God. So he was the father of the Indian nation. We called him Rashtrapita. Lovingly, we called him Bapu, loving father. He was a barrister, he was a lawyer, trained in London. And for the last 50 years of his life, he pretty much lived like this, no? And spun his own cloth, and you can't see it, but he's wearing a loincloth that he spun with his own. And he's traveling by train, and what class of service is he traveling by? Can you tell? Third class, no? And you can imagine this drove his people, my grandparents' generation. Bapu, why do you travel third class? We as a country can do better. Yeah? So President Obama has, what's the plane called? Air Force One. And Michelle Obama is first lady. Yeah, I mean, Anuja and I, as we were traveling here to Las Vegas, we got bumped up, as my wife Anuja, who's here, to first class. And I mean, how do you feel? I mean, this is a Facebook moment, no? Take a picture, and I mean, have you really traveled first class if nobody knows you've traveled first class? So, Bapu, the question was, why do you travel third class? And his response was always the same. I travel third class because, as you know, there is no fourth class. I travel third class because, as you know, there is no fourth class. Now, this kind of a mentality, this kind of a mindset, this kind of a sensitivity is very uncommon. Like the Lincolnesque sensibility of son like you, tall enough that my feet reach the ground. And what we are saying is this tremendous potentiality, hidden, untapped, that lies in flipping mindsets. Because what Gandhi is really saying is, if you begin to experience things and look at things from the perspective of what you call the fourth class, you will have a very different sensibility. Whereas we, when it comes to problem solving, are obsessed with best case scenarios, best practices. There's nothing wrong with it. But it just takes us to a different place, is what we are saying. So what's the positive deviance approach? You connect the Nazareth Dean story with the Mother Teresa story and the Gandhi story, and you've got the conceptual elements of the positive deviance approach. And I must apologize for not putting it in bulleted PowerPoints. No, I mean, that's my folly. Forgive me for not having an illustrative PowerPoint for that. So now let me bring this together with a real case of solving a complex problem. The year is 1990, and in 1990, and this is a true case, it's a very well-documented case, 65% of the children under the age of 5 in Vietnam were malnourished. Okay? Big problem. And Save the Children USA sent 2 representatives, a husband and wife team, Jerry and Monique Sternin, to help address the issue of malnutrition. And they had worked with malnutrition in many other countries, and they had primarily used the problem-solving approach, which begins with the problem, which begins with the deficits. Now, something happened that they had to innovate in Vietnam. They were given 6 months to show results, and at that time there was a publication that had come out of Tufts University which had the title Positive Deviance in it. They read it and they said, by golly, we're going to try to address this problem in a somewhat different way than we have in the past. They'd never done this before, this flipping of the mindset. So this is what they did. They started with 4 communities near Hanoi, where there were 3,000 kids under the age of 5. And of course, you can measure, you can weigh all these 3,000 kids. You can take their circumference, and you can say, based on their growth chart, whether they are malnourished or not, which is what they did. And then they asked this quintessential positive deviance question, which is usually never asked. And this is what the question looked like. And that's Jerry Sternin, and it's a flipped question. No? So Jerry, you can say, was my guru of positive deviance. I first brought him to Ohio University when I was there in 2005, I think. And I said, I'd like to apprentice with you because I had found him in 2004. And he always did this, no? He's like, flip it, flip it, flip it. Singhal, flip it, flip it, flip it. No. So the question was the following. Are there children under the age of 5 from poor rural households that are well-nourished? Do you see Mother Teresa here? What's working? Do you see Gandhi here? What's working for the 4th class? And obviously, it's a question to see what you ordinarily can't see. Because you would expect, all of us who run regression equations will hypothesize that kids who are well-nourished would come from families that are well-supported, right? Yeah. So this was an unasked question. This is a question we rarely ask. So basically, you're asking, do I see healthy children? Mother Teresa. Among the poorest of the poor, Gandhi. Because that is where the donkeys are hiding. If there are kids who come from the poorest of the poor families, who are well-nourished, because the norm is what? If you come from a poor, rural, remote family with a mom who has a very small piece of land, your child is going to be malnourished. But the fact that somebody has solved the problem, if you can find them, that's where the answers lie. Because if they have solved it and solved it in their context with the worst odds, the donkeys lie there. Get the idea? With me? How those 3 stories come together? What the positive deviance approach is? Yes? Okay, good. So what did they find? Okay, you can read this, but the key was that they got the community involved in identifying kids that were healthy that came from the poorest of the poor families. So that the community members were like, this can't happen. Impossible. Implausible. But no, we did weigh them, and they are well-nourished. So the community is intrigued, right? And so it was the whodunit. What happened? So the community was asked to figure out what the heck was happening. And something must have been happening because they didn't have access to extra resources. They must have been doing something, right? So now you know where to look. So, teams went out and they looked and they found a few things, simple things. What did they find? There were a few mothers who were adding the shoots, the greens of sweet potato plants to the pho, to the rice. What do we do with the greens of sweet potato plants? How many of us eat the greens of sweet potato plants? No positive deviance here. One hand went up, and you're a positive deviant, ma'am. What's the point? When you label something as sweet potato, you become interested in the potato. That's the mindset. You don't think about the greens. This mother who was thinking about the greens, so the solution to the problem was there. And now you can explain it nutritionally, sweet potato, vitamin A, beta carotene, blah, blah, and all that. And, they found several things. One of the other things they found is that oh, this mother, this crazy mother, was actively feeding her child. What? She's actively feeding her child. Well, what's so crazy about that? Well, the norm is when the child begins to sit, you put whatever you wish the child to ingest in front of them because, the mother's busy and the child eats some and drops some and leaves some and wastes some. This crazy mother, non-normative, positively deviant mother, deviant because she's not the norm, positive because her child is healthy, was actively feeding her child. And what happened when she worked in the field? She asked a sibling to actively feed the child. There were some mothers who were taking teeny tiny shrimps and crabs and shellfish from the rice fields, which are there for the plenty in Vietnam. Things which ordinarily mothers would not collect because it was considered as chicken food or duck food. If you label something as chicken food or duck food, that's the way it is. But these mothers were picking these up, removing the shell, the crustacean, and giving it to their children. The solutions to the problem were there. The donkeys had been coming and going for a very long time. And by asking a very different question, those solutions were discovered. So far, so good? You with me? How are we doing on time? All right, good. Okay. So now, this is a very well-documented study, and these are the results of this. This happened over a period of 6 to 7 years, and Vietnam basically solved its malnutrition problem. And this is when the positive deviance approach began to be known in nutrition circles and usually in overseas contexts. So let's define positive deviance. The visual may again. The premise is that there exists in every community, if we have the eyes to see it, ordinary people who have found extraordinary solutions to existing problems against all odds. They are a very small minority. They're rounding error. They're outliers. And we know what we do with outliers, no? We love normality. We love central tendency. So PD, positive deviance, is bathed in data. In Vietnam, the example that we gave you, 3,000 kids, you weigh them. 35% of them are the green dots, right? Those who are well-nourished. But then you keep eliminating all the green dots, the ones who are well-nourished, until you find somebody who is well-nourished and is unexplainable, right? It's the unexplainable ones that you are interested in. So it's a completely data-driven approach. I'm going to give you 3 quick examples of applications of PD. After PD, positive deviance, began to make inroads. The first time it came to the US was when Jerry and Monique Sternin retired and came back to the US to retire in 2004, which is the first time I met them. And there was a very big, complex problem. There is a very big, complex problem that people are trying to solve and don't know how to solve it. And that's the problem of, I don't know how many of you know, hospital-acquired infections. We go to the hospital to get well. Well, you may get well. But 3.5 million people acquire an infection when they're in the hospital. Infections that they shouldn't acquire. And over 100,000 die. It's a very big public health issue, quite under the radar. Hand hygiene compliance rates, which is a very simple technical thing, washing your hands before you have an encounter with a patient, in US hospitals average about 38%, which means that anytime anybody touches you in a hospital, the likelihood of that hand, that touch being a vector of infection transfer is almost 2 to 1. Yeah, you get the idea? That's the reason why. How do you solve this? You can have directives coming from the 14th floor, as have been coming for the past how many years, and we know what happens, no? The worst offenders are who? Physicians. Among the physicians, who are the worst offenders? Surgeons. Surprise you? Yes. Well, maybe not. They're gods, no? Who's going to tell a surgeon, oh, sir, you did wash your hands, but you just touched your beeper because your wife called, and nobody can, no? So people die because people cannot speak up. Get the idea? It's not a simple issue. It's not a technical issue. It's a complex behavioral issue. So we asked some very simple questions. And again, this study was funded by Robert Wood Johnson Foundation, went on 4 years in 6 hospitals. And I'm just going to give you one example of what we found. But basically, we asked, are there ordinary people? Is there a patient? A patient? I mean, patients are the problem, right? Is there a patient who's figured out a way to make sure that before anybody touches him, that their hands are sanitized? Yes, we found Daryl in Pittsburgh. What does Daryl do? When a healthcare provider walks into his room, Daryl will look at the healthcare provider and smile. And if the healthcare provider doesn't wash their hands or go for the sanitizer, Daryl smiles and then turns his head because he doesn't want to make eye contact. And then what does he do? He turns his head back again, looks at the healthcare provider, smiles, winks, nods, and is telling them, What Daryl does is not normative behavior. Daryl has found a solution. The wisdom to solve the problem exists there with a patient who usually is powerless. He's a positive deviant. So what do you do? The question is, what do you do with what you find? What do you do? So we asked Daryl and the patients, what should we do? Here's wisdom. They said, okay, can we just make a little poster, cost 50 cents, laminate it, a poster that was designed by the patients, which looked like this. And then we said, what do we do with this poster? Well, just put it right in front of the wall where our bed is. No? Oh, okay, well, what are you going to do? Well, if we don't have the skills of Daryl, if we can't wink and nod, all we do when a healthcare provider walks in is we keep looking at this poster. And we keep smiling. Get the idea? Okay. There were at least a few hundred such nuggets that we found in work in these US hospitals. And again, this is very well documented. This is what happened. While MRSA and hospital-acquired infections are skyrocketing in US hospitals, in these 6 hospitals, in the units that applied positive deviance. Let me give you a case of prisons in Denmark. Denmark does a remarkable job when it comes to the issue of recidivism compared to the US. No, I mean, any country would do well when it comes to the US. Denmark does a very good job of rehabilitating, let's say, its prisoners, but it comes at a very high cost. What's the cost? The people who work in Danish jails, the officials, the jailers, have the highest rates of mental illness. They have the highest rates of absenteeism. The average age for retirement for a government employee in Denmark is over 60. The average age for retirement for those who work in correctional facilities is 48. Get the idea? Stress, burnout. They'd been trying to solve this the conventional way. Until one day things flipped and somebody asked a very different question. And the question was against all odds. In maximum security prisons, right, where you would expect most stress, are there any guards who have had very low rates of absenteeism or none? The average number of days that a guard was absent was 33 in maximum security prisons in a year, 33 days. Who have had few mental health prescriptions or none, and who are psychologically thriving, and there were some measures in terms of, And the answer was yes, not very many, but we do have a few. Oh, we do? Okay. The donkeys are there, right? The solutions are there. So let's talk to these people. And this is all data-driven, right? Absenteeism, mental health prescriptions, age at retirement, blah, blah, blah. Okay, what did they find? I'll give you a couple of things. Those who were psychologically thriving weren't very absent. Some of them had made an informal pact that they would not read the dossier of the prisoner when the prisoner would come in. What's the normative practice? First thing you want to know is, like, who's checking in, right? I want to know, what maximum security prison, what have they done? The difference was what? They were not reading the dossier. In fact, their words were, in order to save ourselves, we kill our curiosity. What does that do? Like, what does that have to do with stress and burnout? Well, you decide. If you know whom you're walking with, how do you behave towards them? How do they behave towards you? As opposed to, well, I don't know. Non-judgmental, maybe, I don't know. You get the idea? It was another thing they found. There was one or two of these crazy jailers. When a prisoner checked in, ordinarily, normative practice is what? You check them in, you fumigate them, you give them orange clothes, then you lock them. Some of these guards would give the prisoners a tour of the prison. Welcome, to this facility. And let me show you, where your gymnasium is. And, there's the swimming pool, and you get a few hours on Friday, and that's the bubbler. You can get the idea? Non-normative practice. What does that do? I don't know what that does, but it was doing something. That was the difference. That was the donkey. They've been given these tours for a long time. The solution to the problems were right there. If only we had the eyes to see it. You only could develop the eyes to see it by flipping the questions. Asking questions like this. How are we doing on time? All right. Couple more minutes. You're okay? Okay. Claudia, where are you? Claudia's here. This comes from Claudia's MA thesis. I also want to acknowledge there are quite a few people here. Davi Kalman is here. Claudia is here. Jessica, where are you? Breastfeeding the baby. Her positive deviance study was on breastfeeding in the workplace. Yeah. And Anu is here, and Shrinkla is here. There are lots of people here who at UTEP, the place where I am, are doing work on positive deviance. We are asking questions about teenage pregnancy, about diabetes, and so on and so forth. So this is Claudia's work. She asked a very simple question, a question which previously was not asked. In El Paso, border area, high rates of diabetes, Hispanic, get the idea. You ask a question, are there some folks? Yeah, you ask that question. Who, and her question was more complicated than this. I've simplified it, sorry, Claudia. Who have figured out a way to manage their diabetes with no or low medication? The implausible, the improbables. And yes, the answer is you found a few. How many? 12. 12, And of course, Claudia discovered many donkeys. But one of the donkeys was self-disclosure. The best thing you can do to take care of your diabetes is to self-disclose. The best prescription that a doctor can write for you on his prescription pad is please self-disclose your status. Why? What does that do? What does that do? Well, you tell your friends and your family, and now they know, and now there's an ethic of care which didn't exist before. Get the idea? That's her finding. One of the findings. There were many others. Yes? So, what's the point? The point is the following. When you ask improbable, and I'm using the word probable in a probabilistic sense, and implausible, positive deviance question, flipped questions, the answers that you get will be surprising. They have to be, because you're asking a question that doesn't make sense. So what you're going to find is not going to make sense, right? Because the answers are going to be very simple, as it seems was the case in the examples that I've given you. Surprising answers, surprising solutions, accessible to all, because somebody in the fourth class has figured out a way to do it. So if they can do it, others can do it too. If you've discovered it, if you can find the donkeys. The assertion that I'm making that my colleagues and I who work in this area are making is that the positive deviance questions that we ask and the solutions that we find are fundamentally communicative. Why, that's a great thing for our discipline. So you're asking, what is it that I see? Or what is it that I don't see? What is it that I hear against the war? Or I don't hear for peace? Yeah? On whose behalf am I hearing? Fourth class? Third class? And then the answers you find, you think of a Daryl. What has Daryl figured out to do with his wink and a nod and his silence? What has the jailer figured out to do? I don't read the dossier. I'll give you a tour. What has the diabetic in El Paso figured out? Self-disclose. Communicative. And this shouldn't surprise us, because if people have solved a problem without access to any extra resources, they must be doing something. And that doing, based on the work that we are all doing, seems to be communicative. Wow. Hooray. Maybe our field will get the Nobel Prize someday for solving the most complex problems of the world. That's my hope. I'll end with His Holiness the Dalai Lama. He was once asked in a public gathering, Your Holiness, what is the meaning and purpose of life? Simple question, no? And I mean, he's an expert, right? He should know. And he smiled and he laughed. And then he said, your question was, what is the meaning and purpose of life? My answer is, I don't know. It's the first thing from expertise. I don't know. But then he said, since you've asked, because you've asked, I should try to answer this question. And so if the question is, what is the purpose and meaning of life? My answer is, the whole purpose and meaning of life is to spread the Walmart. The whole purpose and meaning of life is to spread the Walmart. And I think there were chuckles. Your Holiness, I mean, are you on acid or, He said, yes, the whole purpose and meaning of life is to spread the warm heart. So what is it that we say? What is it that we hear? They're communicative issues. So, always end with Robert Frost. Thank you very much. Thank you. Is it already 6? All right, we have 5 minutes. We're going to flip the Q&A. What? Oh, yeah, we're going to flip the Q&A. I'm going to ask the questions. You are the ones who are going to answer. Because how do we normatively do Q&A? One person gets up and they speak, and many of the others may be rolling their eyes or like, oh, God, what, Why do they have to ask this question? Isn't time? Yeah, you know how that goes. One, very limited interaction. Well, there's another way of doing it. So the invitation to you, the question to you is the following. Based on what you have heard, seen, experienced, perhaps you have some thoughts. How does this relate to my work? Oh, gee, this is so far out, I can't even comprehend this. You may have questions, you may have a comment. I suggest you all rise. And I'm not saying stand up. That means different. Rise. Please rise. Rise, stand up. Rise. See, you understand stand up. Rise. Get in a group of 4, okay? In a group of 4. So find 4 people. It can be 3, doesn't matter. Spend 30 seconds in that group of 4. Share in your first thought. Okay? Start now. Take another minute, 1 more minute. The time is 6 o'clock, and so may these conversations continue. Please give yourselves a big hand. All right.